Assalamu alaikum. So in this lecture, we're going to talk about the accessory nerve, which is cranial nerve number 11th. And we're going to cover all these headings, which I've talked about in my previous lectures. So let's start. Now remember, accessory nerve is a cranial nerve which has two major roots. It has cranial root and it has spinal root. So when we talk about the cranial root itself, so in cranial root, the nucleus is present at the level of the medulla oblongata, which you can clearly see it. Remember, it's exclusively a motor nerve, so it's going to only talk about the motor activity. So right, you can clearly see this is the main motor nucleus of the accessory nerve present at the level of medulla oblongata. As you can see the connections, it is connected to the cerebral cortex. The fibers are descending down to the motor nucleus of the accessory nerve from the cerebral cortex. And then this cranial root basically emerges again from the junction between the inferior cerebellar peduncle and olive. You can clearly see it here, right here. And it runs lateral in the posterior cranial fossa, and it exits the cranial cavity along with vagus and glossopharyngeal nerve from the jugular foramen. Now, as far as the spinal root is concerned, the accessory nerve, the spinal root, as the name suggests, it's going to originate from the spinal cord, and these nuclei are present in the interior gray horn of the spinal cord in the cervical region, and this is also connected to the corticospinal fibers from the cerebral hemisphere, and it's going to emerge from the spinal cord clearly. That you can clearly see it here. This is where this nerve is emerging from. That's the spinal root of the accessory nerve. And then it basically ascends upward because obviously the nuclei are present right at the level of spinal cord while the cranial part is present at the level of medulla oblongata. So this ascends upward, becomes part of the root of the cranial, the cranial, joins the cranial part, cranial root, and then it becomes one nerve, and it ascends up in the foramen magnum and finally joins the cranial root, and the rest course is exactly the same as studied in the cranial root. As far as the functionality of the accessory nerve is concerned, it's a motor nerve exclusively. It supplies the muscles of the soft palate, it supplies the muscles of the pharynx, which are the extrinsic muscles, and it supplies the muscles of the larynx, again extrinsic muscle, and is also responsible to supply the trapezius, as well as it is responsible to supply the sternocleidomastoid neck. So this was all about the accessory nerve. If you have any question, please feel free to ask. Thank you.